Good afternoon, everyone. So today I am going to make video on the shoulder examination. Okay. So in the shoulder examination, first of all, we have to know. First of all, we have to examine the spine also, because shoulder pathology or upper limb pathology may present with the C spine problems also. So first of all, we have to going to examine the C spine. For C spine exam, simply ask the patient to do simple flexion of the neck, extension of the neck, then side to side movements. Check the side to side movements also. Okay, that's all. Then again, you like I told you in the hip examinations, uh, examine from front whether the head is in the bang in the center or not, your both shoulder are same level or not, or all the your trapezius muscles can be seen, your uh, um, vesting of the trapezius muscles, or your pectoral muscles, and your deltoid contour. All these should can be seen from the front. From side, again we have to see your sagittal balance, whether it's positive or negative. Then again, we have to see any resting of this deltoid contour, and any resting of your biceps, triceps, all that. And again, from the back also we can examine from the back also. Same thing. Then come to the proper shoulder. So shoulder examinations first of in many pathology can be present with, whether it is your impingement is there, whether it is your rotator cuff tear, ACJ joint arthritis, your frozen shoulder. All these conditions, main condition is there. First of all, we going to talk about which condition present in the which age groups. So it's not the uh, rule that present that's perfect uh, given age group, but the mostly it's seen like from 20 to 30 year of age, your instability of the shoulder is present, and from 30 to 40 years of age, your maybe your impingement. Okay, and then 40 to 60 year of age, your maybe your impeachment or your rotator cuff tear, and from more than 60s mostly your ACJ joint arthritis. More than 60s mostly seen your ACJ joint arthritis. ACJ joint arthritis. Okay. Then comes to first of all, then your movements. So movements. This is sample flexion, flexion of shoulder. Okay. This is extension. Okay. Then this is abduction, abduction, adduction. Okay. These are main movements on shoulder. Okay. Then comes to the pathology. Like first of all, we can discuss about your pathology, like your instability. So instability is mainly seen in I told you age group of 20 to 30. Mainly it's in 20 to 30 age group, and instability is we can find out the just see the contour of deltoid, or just pull this back, see the any sulcus sign, that is sulcus sign I have to can see. You pull that in the instability. Also, other test is your apprehension test. Apprehension nothing but just extend rotate and abduction and extend rotate of the shoulder. Okay, then see the, okay, patient face, then see the it is feeling any pain or not. Apprehension can be done in the lying down also. Apprehension test. Then other than the load and shift test. Load and shift is just load your shoulder on the its position, then shift is anteriorly to see the anterior instability, posteriorly shift posteriorly to see posterior instability. That is load and shift test. Load and shift test. After that, instability, we can jump on to the your so instability. Other test is for instability is your I think sorry, after instability we can jump to the your impeachment. Impeachment is the two tests important in impeachment. One is the knee test. Knee test just is flexion the your internal rotate and then give pressure. Impeachment or see the impeachment. Your knee test. Knee test is just flexion and internal rotate then give pressure. Other test is Hawking Kennedy test. Hawking Kennedy just flexion the shoulder and 90-degree or flexion of 90-degree your elbow, then internal rotate and then see the pain should be somewhere side of your shoulder. So see the different positions like this. Okay, that is your Hawking Kennedy test. So main thing you have to know is your ACG joint pain, arthritis pain is here. Okay, then your impeachment or your rotator cuff pain is comes to the side of the your shoulder. Okay, somewhere here. Okay, then of course in palpation I have to forgot to tell you palpation. Sorry about that. So you have to palpate from the your acromioclavicular joint to the like this to the or towards the your ACG joint. Then also palpate your core process to see any tenderness on core process in front, and of course your uh, spine of the your scapula, back. So all these for the tenderness you can palpate. Of course, for the biceps you can palpate somewhere here, biceps tendinitis, anything else, bicep tendon pathology. Okay, so I think I finished the impeachment. Then comes to the main thing, that is your rotator cuff tear. A rotator cuff tear somewhere present around 40 to 60 year age group, and in rotator cuff tear there is in the rotator cuff there is around four muscles is there. So first muscle is your supraspinatus, second is infraspinatus, third is teres minus, fourth is subscapularis. Your first your supraspinatus for your abduction, and your infraspinatus teres minus your external rotator, and your subscapularis your internal rotator. Okay, internal rotator. Okay, then first of all come to the supraspinatus. Supraspinatus is your abductor. So you have to abduct your shoulder and look at that there. Then your arm should be in 15 to 30 degree around from the scapular plane. Internal rotate it. Then see, this is your empty contest. Then if it is a patient can hold this position, that is negative for the supraspinatus. It means supraspinatus is intact. There is no tear. If it is your view for looking for strength, then you see like that. Okay. Then comes to the your external rotator, like infraspinatus and teres minor. Just external rotate your arm. That is test for the infraspinatus and teres minor. As well as you look for strength like this. You pressure, look for strength. Okay, like this. Then to segregate to the TDS minus from the your infraspinatus. That test is your horn blower test. Horn blower test nothing but you do simply abduct your arm, and then just simply you pressure like this, and ask the patient to give strength against your hand. So this is simple whole blower test. You can ask the patient like this, below hole like this position to be do like this, then your teres minor is intact. Then comes to your last muscle is your subscapularis muscle. Subscapularis is for the internal rotation. So internal rotations just do like this, okay, and give pressure, okay. I can show you, like give pressure like this, okay, to see the strength of this subscapularis muscle. So these your for the your rotator cuff here. Then comes to your biceps tendon. Some test for the bicep tendon. One is the speed test. The speed test is nothing but give pressure simply like this. Your hand should be like this, palm straight forward. That give pressure. Okay, that is your speed test for the biceps tendon. And again, your Yargusen test is you just flex your shoulder and your internal rotate it, and just give pressure over that. Means supinate against the resistance. Supinate your hand against resistance. Okay, supinate your hand against resistance. That is your Yargusen test. Then comes to the your labral tear. Labral tear is what is the labral tear? If you throw ball like this position, you throw ball. In labral tear, you can't throw in this position. In labral tear, okay, you can't throw in this position in labral tear. You can't throw. So you can throw like this or like that, but you can't throw in this position in labral tear. Okay, you can't throw ball in this position. If it is patient cannot throw your ball in this position, then it is labral tear. One test for the laboratory is O'Brien test. O'Brien test. What is O'Brien test? O'Brien test little bit have similarity to the your empty can test of supraspinatus. So supraspinatus empty can is like this, almost 30, 20 to 30 degree scapular plane, but 15 to 20 degree internal rotation. Internally, it is your O'Brien test. O'Brien test just give pressure for here like that. Is O'Brien test for your labral tear. Okay, then lastly comes your frozen shoulder. Frozen shoulder is patient have a severe pain in frozen shoulder, and patient have very less movements in your shoulder. In case of your impingement and your cup tear, you can passively, if patient actively do this movement, but you can passively take movement further. Okay, but in case of your frozen shoulder, you can't do that. Your movement is up to here, then you can't do further. Okay, that is your frozen shoulder. Then it comes to your painful arc. Just do a circle pose like this. Around 60 degrees pain is coming. That's for most likely maybe impingement. If it is more than 90 to 100 degree, that is for the SCG joint pathology. Okay, painful arc. Okay, that is your painful arc. So I think that's enough for the shoulder. Okay, uh, comment below and tell me my mistakes. Please do tell that. I will be very happy if you tell my mistakes in this video. Have a good luck.